Hi, Tom Rankin for Sense Study Group. Every month at Sense, we have a theme. The theme for this month, October 2025, is Expanding Horizons. One session out of study group every month is devoted to relating the theme to a functional integration lesson, the hands-on, one-on-one sessions. So this month we're going to explore how can we use the concept of expanding horizons in a functional integration lesson. There's a lot of ways we can think about this in a functional integration lesson. We can directly use the eyes and see how that affects our ability to expand our horizon, or we can indirectly use the eyes in a lesson and see what the results are after a lesson if our horizons opens up. That's a literal sense that we can use this. Today we're going to do something a little different though. We're going to think about expanding the inner horizons during a functional integration lesson. Expanding the inner horizons is a little esoteric. It's kind of hard to understand. So we're going to change our thinking. We're going to move over a little bit and we're going to think about how could we expand our self-image. Feldenkrais wrote that we act in accordance to our self-image. Our self-image acts as as an operating system that will determine how we act. So when we're working with a client, how can we present a lesson for them that is going to expand their self-image, that's going to improve their operating system, let's say an upgrade, give them an upgrade so they can operate better into things that they want to do in life? The first thing is determining what the client wants to improve. If you watch any of the lessons with Dr. Feldenkrais or Mia Siegel, you'll see that they spend time talking to the person they're working with to get an idea of who this person is, what they want to do, what's important to them. The example we're going to pick for today is an older man who has a very concrete thing he wants to do. We're going to go for a simple example, and that is he's having trouble getting out of a chair. We're going to look at the idea of how we can look at what the man does, see what's missing in his self-image. Can we create a lesson so he can learn what he needs to expand into his self-image, so by the end of the lesson he'll be able to get out of that chair in an effortless and easy way and make his life better. So now that we know the goal, one thing, we know the goal, we know the intention of the lesson. How can we help this person learn how to get out of a chair easier? The thing that makes Feldenkrais different is that we're not going to tell him how to do it. We're going to create the experience in which he's going to teach himself the best and easiest way to get out of a chair. And that's what the elite Feldenkrais practitioners are able to do. They don't tell you what to do. They give you an experience where you can explore and discover a wide variety of things, and by the end of this experience you discover and teach yourself the best way of doing this. So we have the goal. Now the next thing, we really need to see what the person is doing. How do they get out of a chair? If we don't know what they're doing, it's really hard. We don't know what they're missing in their self-image. So I'm going to play the part of the man so you can see how I'm getting out of the chair, doing a little bit of acting here, and then we'll just go from there. I'm playing the part of the man sitting in the chair, and the question's easy, is how do you get out of the chair? And this chair is going to become a little bit more difficult. It doesn't have arms. I could pretend there's arms on it. So if I'm pretending there's arms and the arms are here, I may see that he does something like this. Right? He's pushing himself upward, coming right up from the chair. So seeing this, seeing how he's thinking more up, and he's driving and forcing and muscling himself up, I have an idea that in his self-image, he doesn't have an idea of how he can put his pelvis into a better position to help getting up be easier. And he may not know how to rotate from the hip joint in order to help move his pelvis into a better position. So I see something that's missing in the self-image. He doesn't really know what he's doing with his pelvis. He doesn't know what he can do with his hip joint. His thinking is up. And just trying to force himself up makes the movement very difficult, because you can see my center of gravity is back here. My feet are up here. And my center of gravity isn't over my feet. It puts me at a mechanical disadvantage. Now, I'm not going to tell the person that, because I want him to learn from the experience how he can do this in an easier way. So we have an idea, I have an idea what's going on, what may be missing from the person's self-image, and now it's time to create the experience in which he can teach himself what he can do. So what I'm thinking, okay, well, we have Feldenkrais lessons that help with a variety of things, and I'm thinking, well, let's start with the idea of 6 to 12. And then what I'll do is I'll put certain things in, certain differentiations, things into the 6 and 12 lessons to hopefully help him learn the things and discover the things he needs to learn. So we're going to move on to the table portion of the FI. I'm positioning this so you can see the hip joints, and that's going to play a big part in this FI. So the first thing, we'll just have the person bend their knees, bring their leg into standing, and we're going to start with what he already does. And what he does when he's trying to get up, he pushes with his feet and he's pushing himself upward. So he's going to do the movement of pushing, with your legs, and you can see he's kind of sliding a little bit as he pushes with the legs. And you may see the head tilt a little bit, and the pelvis and the spine kind of going to the back. So, I'm going to ask him, do you notice what part of you is moving toward the table as you push with the legs? And he may notice that his back is flattening, and he may notice that his pelvis is tilting backwards. So the pushing of the leg is bringing him back toward the table. And this is important because I'm not going to tell him this, we're going to discover it later in the lesson, but when you push too soon in the chair, it's moving you back into the chair, which is making it harder. Now you're working against yourself trying to get up. So now we're just going to start with the idea of exploring movements of the pelvis and movements of the hip joint. And maybe doing this without pushing from the legs. So we can do something like this, where we're bringing the legs up and down and just noticing how bringing the legs in this movement will also move the pelvis, the spine, the head. Right, and we call this an undifferentiated movement. Everything's going together. And we can ask them, do you feel the pelvis moving, the back flattening? We can give him these in-between questions so he can feel what's happening. And then we can do the movement in a different way. And we're thinking about doing the movement in a way where the pelvis is fairly quiet and just the legs are moving. And we could explore different things. We can explore that if the legs are too close, notice how there's some movement in the pelvis. And he may notice that the hips don't move as freely, but if he lets the knees drift a little bit apart, we can notice that there's more movement in the hip joints. And just asking him if he can feel the ball. When the ball of the femur is rotating upward and when it's rotating downward. So now he's getting an idea and a feeling of differentiating of the ball and socket joint. He's differentiating the ball from the socket, right? This is the hip socket and this is the ball, the femur, the head of the femur. Right? The hip's not moving, the socket's not moving, the ball's moving. So that's one thing we can do. Now the other differentiation that we can make is keeping the legs fairly quiet and moving from the pelvis. So now the legs are fairly quiet and it's the pelvis that's moving. And we can see if this is working okay. Sometimes what's helpful, if you have a small roller, and depending on the person, if they don't have any back problems or issues, you can have the person come up a little bit and you can put a little roller right under the pelvis. Find a nice place for that. And now you can see with a little bit of with the roller here, it's a little bit easier to get the pelvis tilting forward, tilting backwards, and moving relative. And once he gets the idea of moving from the pelvis, and keeping the legs relatively quiet, right? And you can, if he's moving the legs too much, you could even put your hands here to gently remind him to quiet the legs. Or, you can say, can you move your pelvis into my hands? Can you move your pelvis away from my hands? So he can learn how to create the movement from the pelvis. And once he has this movement down, and he understands the movement from the pelvis, you can tell him that this is what they call a hip hinge. When they talk about doing a hip hinge, whether it's a physical therapist, a personal trainer, a Pilates instructor, the idea of the hip hinge is the pelvic, the socket is differentiating from the head of the femur. So the head of the femur is relatively quiet, and you're moving from the socket. And this is useful because a lot of times we hear things like hip hinge, and while we may have a mental idea of what it is, we may not have the idea how to physically do the movement. So it may be something that, and I've seen this in a lot of fitness classes, people say, yeah, okay, I get it, I'm moving from the hip, but you watch what they're doing and it's not moving at all. So that part of them, that part of their self-image is not clear, it's fuzzy. So with this kind of movement that we're doing here, now he's getting the idea of moving from the pelvis to create the movement. And then eventually, we can have him explore the different ways of doing these things. We can explore the pushing with the feet, what kind of movement that makes. Differentiating the head of the femurs. Right, he can do something like this. So he can do it undifferentiated when everything's moving together, or he can feel how he can keep his pelvis relatively quiet and create more of the motion from the hip joint, differentiating the femur from the pelvis. And then the third way he can do this is now he's learning how to initiate the movement from the pelvis. So now the legs are fairly quiet and the movement is occurring from the pelvis, and he can feel the hinging of the hip joint, which is the pelvis moving over the head of the femur. And when these three movements are clear, then it's time to take them back onto the chair and see if we can harvest the lesson, if we can finish the lesson with a clearer understanding of how it can get up. Once again, I'm playing the part of the older man. And we're just going to do what we did on the table, but now in a seating position, to see if he could understand and differentiate between doing things the different ways. So the one way is pushing with the feet, and I can feel that. I can feel the pushing of the feet, and I can feel as I push with my feet how that brings me back into the chair. So if I'm pushing with my legs and trying to get up, I'm kind of working against myself. And now this starts to make sense because I can feel what that's doing to me. The other thing we did, right, is we can take one leg, and I can feel as I lift the leg, now the pelvis is going back. So this is undifferentiated. And then if I can keep my pelvis quiet and just move the leg relative to the pelvis and the torso. Now I can feel I'm differentiating the ball from the socket. And I start to understand the idea of this is undifferentiated, all of me going, and I don't feel as much movement in my hip socket, but as I create this movement and I stay relatively quiet with the pelvis and the torso, now I can feel more movement in the hip socket, the ball of the femur rotating in the hip socket. And then finally, right, we can initiate the movement from the pelvis. So I can do this, and if I'm having trouble, I can use my hands to kind of feel how I could tip the pelvis backwards, tip the pelvis forwards. Right, this is undifferentiated because my spine is bending and extending, so that wouldn't be a hip hinge. Now, if I could keep my spine quiet and in its neutral position, now as I go forward and backwards this way, this is a hip hinge. So tilting the pelvis forward and backwards with the bending and the arching of the spine, the flexing and the extending of the spine, that's not a hip hinge. Keeping the spine straight and then just rotating the pelvis forward and rotating the pelvis backwards, a hip hinge. So now he's differentiating, he's learning, he's doing different things and learning, okay, this is one thing, and this hip hinge is quite a different thing. So now we understand all these different concepts, and now we can start to play with how we can get out of the chair easier. And one thing to make life easier is just headed toward the edge of the chair. And we can try two different ways. We can see, you know, how is it moving towards your feet, sitting back, and you can feel you're pretty far away from your feet. We learn from differences, right? So now we can walk toward the front of the chair. And now as I move forward, I can feel that I'm a lot closer to my feet. Having the experience of each one so he can feel is really, really important. And then we can start with the idea of, okay, how could we move in such a way that we can bring our pelvis over our feet, right? And, you know, we can try different things. I can push with my feet, and I see that my pelvis is going opposite, so that's not something I want to do. Okay, so, you know, maybe I think of not pushing with my feet, you know, I can kind of roll back. Okay, and one way you can do it is, you know, I'm starting like this, kind of rolling back, and then if I just kind of keep continuing, and then going forward, you know, eventually I can roll forward. And, you know, we can try that. He can see whether he likes that, and he can see how practical that may be, sitting in, you know, by a table or something. The other thing that we can play with, right, we talked about moving up, we could play with foot spacing, the feet are far away from you, well, it's like sitting back in the chair. So maybe finding the place close, so your feet are as close to you as comfortable. And then the other thing is how wide apart the knees are. So we're thinking of tilting forward. And if I'm tilting forward and the knees are close, I can only go so far. So maybe I need to open up a little bit. And now I can see I can tilt forward easily. There's variations, there's choices that we can do. One interesting choice is putting the back of the hands in front of the legs and then just thinking about sliding your hands down toward the outside of your foot. And you can try that. And then just sliding the hands back up. So you're just thinking, okay, I'm going to touch the outside of my foot. And I'm just going to follow my hands down and back. Right, and then I can reverse it. I can take my hands to the outside of my foot and then come back. For some people, coming this far forward may feel kind of scary. So the other way we can think about this is instead of using the hands to push up, we could put the hands on the chair. And what we can think about doing as we tilt forward, we can think about just gently helping ourselves come forward a little bit. And then to come up, we have choices, right? I can bend the knees and I can slowly roll up. I can bend the knees, I can slowly roll down, I can feel for the chair, I can reverse it. Now the other way I can think about this is, right, I'm going to tilt the pelvis forward, hinge from the hip, and then if I need to, I can use the hands to help me come forward a little bit, and now I can just think about pushing into the floor and coming up that way. I have all these different choices, and it's up to me which ones I may find most helpful at the time. Right, and we talked about the hinging. So if I could come forward with a flexed spine. Okay, and I'm feeling that, and I notice if I flex my spine, I have to come forward a whole lot more. So now I'm going to sit tall, and I'm going to try to maintain this length from my tailbone to my head without flexing the spine. Hinging, we learned this concept of hinging, rotating the pelvis, right? These two femurs are like axes, and the pelvis is going to rotate around these axes, right? So now I can think about rotating around the axis, staying tall. I can think about, opening up the hip joints, squeezing the glutes to come up. This is yet another way. We have all these different choices we can do. So maybe that's what I'm doing. I'm thinking about sitting tall. I'm thinking, oh, if my knees are in, I can try it with the knees. That's not very comfortable with the knees in. So now I'm rotating the knees out a little bit. I'm sitting tall. Right, and when I feel a little stuck, I can use my hands to help myself come forward. And now I'm just thinking about opening up the hip joints and maybe feeling my heels go into the ground. So I can feel the movement coming from the center. Right, almost like a jackknife folding open. Right, and now I can think about this folding from the hip back, which is the hinge. This is the standing hip hinge from here to here. I can think of the folding from the hip joint Full, full, full. Feel from my chair and back. I can try all these different ways that we did and pick the one that's working best for me. And let's say that the one that he likes best is getting himself set up tall, having his hands on the chair. He feels safer that way. Having a good place on his knees, they're a little wide. Making sure that he feels his foot on the floor and not the arch, but maybe slightly lifting the arch a little bit, and then sitting super tall, and then thinking about belly coming to the floor, and then opening the hip and he can come up. Once he finds that way that he likes, he makes the choice of what works best for him. Then he just practices that. And maybe what he does, every time he stands up, he just thinks for a moment, remembers what he learned, what he put together, and then maybe you teach him how to reverse. So what he can do, right, he's coming up, and then he reverses it, come down, touches softly, comes up again. And maybe every time he moves from a sitting to a standing position, he does that twice. In a short period of time, that's going to become his new normal. The other nice thing is now he expanded his horizons. Now he's more aware of what the hip can do. And one day he just may find he drops something on the floor, and the way he normally picks it up like that, you know, he feels a twinge in his back, but he remembers, oh, I can hinge my hip. And then I can open my hip. So because his self-image has expanded to include the hip joint, not only is getting up and down from a chair easier, but a lot of different motions like that, where the hip hinge may help save some wear and tear on him, it's in his self-image. He's able to do that. So have fun with this. See if you can find a student, talk to them, see what they're interested in, what they would like to improve, what they would like to make better. See how it ties into their self-image, what may be missing in their self-image that's making it difficult for them to accomplish what they want to do. And then if you can figure out what's missing in the self-image, then you can find a lesson. You can create a lesson to give them the experience where they can teach themselves and expand their self-image to be able to do what they want to do. Take care and have a good day.